Julie Gralow is the Chief Medical Officer at the American Society of Clinical Oncology and joins us from Seattle in Washington State. Julie, welcome to the program. How long have you been working in the field of cancer and how much has changed? What have been the most significant changes in that time?
I've been an oncologist for about 30 years now, and in the past 30 years, we've seen amazing changes. And at least in a lot of high-income countries, we've seen tremendous increases in survival, thanks to early detection and better treatments.
There are figures from the United States that show almost 40% of men and women will be diagnosed with cancer at some point during their lifetimes. How much of it is due to modern lifestyles? I mean, people say that there's more pollution than ever before. Well, obviously there is. What about chemicals? What about the way we work and the way we sleep? All of those things.
They all have an impact. We know that there are a lot of modifiable factors, things like exercise, diet, tobacco, alcohol, and those are changing. In the United States, we're gaining weight. We're not exercising as much. But we also know that there are some non-modifiable factors. And frankly, we're doing so much better with cardiovascular disease, for example, with maternal child mortality, with in a lot of the world, infectious disease, that just the longer we live, the more likely we're going to get cancer.
That moonshot that President Biden has been talking about, he's relaunching his own initiative from when, of course, he was vice president. Will money alone solve the problem, or is it possible that cancer in all its different forms may actually be incurable because there are so many different forms?
Well, I think you'll notice that the new theme of the moonshot is really to end cancer as we know it. It's not a promise to eliminate cancer entirely, but through earlier detection, through better prevention, through better treatments, that we will have much better survival, much better outcomes, and we won't need to be as aggressive in some of our treatments possibly because we'll be finding the cancer early. So I don't think we're going to eliminate cancer, but we will end it as we currently know it.
Julie, how have you found the coronavirus pandemic has affected either cancer care or cancer patients? We have had in the UK, our studio is here in London, we have had people dying from cancer because they weren't able to get their treatment.
The pandemic has been a tragedy in so many ways. And, one of our fears is related to cancer screening. People who don't even know they have cancer, they missed their screenings because we shut down clinics or they were afraid to come into clinics. And now their cancer will be potentially found years later with less of a chance of survival. For patients undergoing active treatment, at the times when our ICUs and our hospitals were full because of COVID, we absolutely had patients who didn't come into the emergency room or the hospital because they didn't want to be exposed, and they suffered at home instead of coming in and getting help, or there wasn't a bed for them even if they came in. So this pandemic has been awful across so many ways, and this is part of the reinvigorating this moonshot. Learn from what happened during COVID, take the good parts. There were some good things we learned how to do, come together to figure out how to make vaccines and therapies quickly, and get rid of the bad parts.
I've been reading about a blood test, a very simple blood test, apparently, that can detect more than 50 types of cancer before symptoms are even showing. And obviously, you already said early detection is critical. What's the issue here and the difference between men and women? Is it true that men are far, far more reluctant to even consider the idea of possibly getting tested?
That's an interesting question, and I'm not sure I know the data on it. We in the United States, women kind of control the healthcare of the family in general. I think you mentioned this idea of what we call a liquid biopsy or a blood test that could detect dozens of different kinds of cancers at an early stage. I think that's something that would be of interest to everybody, both sexes. I'm not sure these liquid biopsies are going to be replacing some tried and true proven screening techniques like mammography, like colonoscopy to pick up a polyp early. But I do think these liquid biopsies offer a lot of promise in finding ovarian cancer, pancreatic cancers, the kinds of cancers that we just can't screen for, we just can't pick up early. And we will, as a result, have much better outcomes because we found those cancers early. So lots of promise with that liquid biopsy or a blood test, but more work to be done.
Julie, thank you so much for joining us. And of course, we all appreciate and acknowledge the importance of your work. Julie Gralow in Seattle.